Prime Minister Modi there with his big message, an appeal to the entire nation, asking everybody to come together in this fight against coronavirus to keep safety and health above everything else right now. If I could just quickly summarize what he said, the first appeal was to ask people to show some resolve and show some patience to ensure that they keep their own health and everybody around their health as priority over anything else. He made a very specific appeal to people to try and stay indoors as much as possible, leading to the request and an appeal for this Sunday, asking people to follow a Janta Curfew, a voluntary curfew from 7 a.m. to 9 p.m. to not step out of their homes unless it's an emergency. He also made a mention of all those who work in the fields of essential services, who've been working round the clock tirelessly in the last 2 months since coronavirus has hit the country and the world. And he said, let's all come together and thank them on Sunday as well at 5 p.m. Let's all get together in your own homes and not outside, or at your door and on your balcony, and let's say thank you to these people. But the message is very, very clear, and like we were telling you, there is no nationwide lockdown the government has announced. The government and the Prime Minister are simply asking you to do your bit in this war against coronavirus. If there were any doubts, here is the Prime Minister making it very, very clear that social distancing is here to stay for a few weeks. With me in this special broadcast is our managing editor, Vinay Tiwari. We'll also have experts joining us right now to tell us how do we take this PM's message forward. Dr. Anant Bhan, researcher for global health, bioethics and health policy, joining us this evening. I've also got Divya Vaidyanathan, Director for Global Health Strategies with us right now. Thank you, both of you. But Vinay, coming to you first. And on that message where he began by saying, मुझे आपके कुछ आने वाले हफ्ते और आने वाला समय चाहिए, also indicating that this may not just be about 1 week or two.
Yes, it is. And I think, I couldn't be happier that you have a Prime Minister whose oratory skills are good. Because if there was ever a time when you needed all his oratorial skills, was perhaps now. Because the one pattern that we possibly saw in the last few days was people not exactly respecting what the health experts and the doctors have been telling them, which is a lot of self-discipline. I think people still haven't exactly fully understood the importance of social distancing, or believe actually that they are possibly immune from this problem and they may not get it. And I think that is absolutely necessary, that he's used a fairly emotional pitch to people. He's asked them for their time. He's given them very specific things to do. And he's also thrown in a few tasks for people on the weekend, which, if nothing else, at least helps spread the message that this is something that is serious and needs to be done. I think what's also important is that he's drawn reference to this being the biggest crisis after the two world wars. I mean, he said that very clearly, that even during the World War I and II, the whole world was not as badly impacted as it is now. So I think he's just trying to tell people that this is a serious issue. Just because we have a lower number of cases as compared to, say, many parts in Europe, we shouldn't really get complacent, because I can, where he's coming from, and it is something that we've been reporting through the days, that there are enough and more examples of complacency that we've seen, some very serious ones as well.
Yes.
People who've been officially, ordered to stay home and quarantine have violated that. They've moved around in public transports, and the tracing back mechanisms have led to hundreds of people being traced back. And remember, in India, it's very difficult to trace back. I wanted to add this point again, that remember in the Punjab incident where more than 100 people have gone missing, the government and the authorities have found that the specifics of the details of many, many people were actually wrong. So possibly they'll never be traced back. So it's a very serious issue. And I think Mr. Modi's speech today should help spread the message, one, because of the fact that he's a good orator, and also that his reach is obviously far bigger than anything else that you can think of.
Well, let me first go across to Dr. Anant Bhan. He was with us last evening as well, helping us understand, how could social distancing really pan out in the coming weeks or months, perhaps. Exactly what the Prime Minister spoke about this evening, Dr. Bhan, and his special appeal also to people to say, take care of those who are economically dependent on you, take care of, those who work for you and the have-nots, because this phase is perhaps going to be the toughest for them.
Yes, absolutely. It is going to be a tough one. And, quite honestly, actually, it was an inspiring speech in parts. And I think there was a very Chuck Day feel to it, almost like a sports coach, pepping up his team and telling them that there is something which is hard, but this is something we can achieve collectively. And I think that was something a lot of us were expecting from our leadership. And this is important because also I think, as we have seen, there have been instances where people have not understood the importance of social distancing, have not understood the gravity of the situation, and that kind of reinforcement from someone who a lot of people respect and listen to will probably, hopefully, make a difference. So while the steps are more nominal, because there's not much which is going to change by just that one curfew on Sunday. Hopefully, this will give people an idea of the kind of challenges that we are going to see moving forward. And I think he has probably also tried to reinforce that many other countries are facing a much more severe crisis. And if we don't learn from that, then we could potentially be headed towards that. So I think he's making an appeal on an emotional basis, but also highlighting the potential impact if we don't listen collectively to those challenges and don't respond. I actually also found it good that he focused on us as a community appreciating those who have to work, who cannot work from home, whether those be in the travel industry, whether those be people who are courier delivery or food delivery individuals, the healthcare workers, and asking us to appreciate that work. Now, that has happened in many other countries. It's again, it's symbolic, but I think it can help reinforce that there are going to be people who will be needed to keep running the essential services while the rest of us go into a lockdown mode. I think it was also good that he pointed out that older people are especially susceptible, and his encouragement that those people try to stay at home as much as possible, and but also saying that of course we need to make sure that those who are the most vulnerable and those who might not have access to routine services because of the kind of shutdowns that we are seeing are provided adequate support. So I think this is only the beginning. I hope that this is taken forward. It'll be interesting to see how Sunday pans out. But I think, this kind of leadership on a more frequent basis, both at the central level and state level, hopefully will make much more of an impact than some of the earlier appeals have. Because I think it is very, very important that we keep reinforcing the importance of public health measures, of social distancing, of following isolation and quarantine requests.
Fact of the matter is that Prime Minister Modi has a huge following, and people do listen to what he has to say, and he knows that and he takes that responsibility on, and he knows that at this point, if he comes out and says this, a lot more people are going to start taking this seriously. But many will be asking this question, Divya Vaidyanathan. What's the idea behind this Janta Curfew? He has asked everybody to, otherwise try and stay indoors as much as possible and not get out unless absolutely essential. But the 14-hour-long voluntary curfew, why do we have to do that?
Well, I think, Tanvi, it's got more to do with messaging coming from the the leadership of the country. As your other panelist was very rightly saying, that he has a mass appeal, and I think it's important to leverage that mass appeal at this point in time. I couldn't help but notice, but he did give certain very subtle hints, saying that people were not taking it seriously. They were going to markets. They were not really maintaining social distancing as it should be at this point in time. He also made it a point to say that we need to take this seriously. We need to take this, the fact that coronavirus is spreading in other countries. We may not be in as bad a situation as they are in, but we do need to be extremely careful given our numbers. So I think it was a very good message, and the fact that the curfew on Sunday is something which is more symbolic. I think people should really now understand, especially the ones that fly in from other countries and are not taking their quarantine periods, for whatever reasons are are not adhering to those instructions, I think it's very important for them to understand that we are a very populated country, and contact tracing, the fabulous job that the government is doing, it makes it as much difficult for them, because there are also limited number of people who are doing that job, and they're also putting themselves at risk. So I think all in all, the timing of his speech couldn't have been better, as we are in stage 2 of this pandemic, and it's extremely important for people to understand that they have to maintain a sense of calm and discipline. So I think the Sunday Janta Curfew is more symbolic. I think people should really kind of get a hint from that and try to stay indoors as much as possible. Of course, we've got no flights coming in for a week from the 22nd of March. So all of that put together, really, it's not exactly a lockdown, as was being said earlier on, and as was being circulated among different groups. But this is certainly time for us to be more responsible towards people around us, and of course, as he pointed out, to really be cognizant of the fact that there are many people who cannot work from home, cannot afford to do it for whatever reasons. Therefore, be cognizant of their contributions as well.
The other aspect that I wanted to bring across for our panelists, as well as maybe we can start with you. While he made the appeal saying, well, you need resolve and you need to show restraint and you need to commit yourself to this duty that we need to do for weeks together, and obviously hinting that we are in this for the long haul. He also mentioned, the fact that there are festivals coming up and religious festivals coming up, but we should ensure that we keep health above everything else.
Yes, and I'm glad he said that, because again, in the last 2 days or so, we've seen examples where, people haven't exactly understood that while, or expressing their religious sentiments on the streets. I mean, you've had situations where mass gatherings have happened. Today they've happened yesterday. And with Navratras coming in, Ram Navami coming in, he's expecting a very large crowd, possibly in other cities as well. And I think it's good that it's coming from the Prime Minister, because people will possibly tend to take it more seriously. Some of these events, as you know, in smaller towns are also organized, where political leaders are also involved and are party to that, and I think it sends a message to them as well. You've seen certain party leaders, even state chief ministers, not exactly leading by examples, where they have organized events and gatherings. So it's very good that he said that, and I think I'm very happy that he's not left out any subject or any issue which possibly doesn't need to be addressed right now. It's something he's touched upon this as well, because it's very, very critical. That is the phase which is going to be very, very important when you have large gatherings in the name of religious expression, which can actually prove to be pretty fatal and dangerous.
Okay. Let me also welcome Dr. Jeffrey Klausner, Professor of Medicine in the Division of Infectious Diseases and the Program in Global Health at UCLA, joining us right now. Dr. Klausner, the Prime Minister of India has just addressed the entire nation, and the big message that he had was asking the people to show some resolve and restraint, to stay indoors as much as possible, hinting at the fact that social distancing could be the norm now for many, many weeks, and we will have to make that effort for many weeks to stay indoors and reduce the social contact. How do you envision this playing out, not just in India, in any other country across the world, where a large population stays indoors for weeks together, works from home, or doesn't go to work at all, children don't step out, elderly don't step out? This is something that we've probably not seen in our lifetime.
Right, and there's actually not a lot of scientific evidence that there's any value to these strict types of isolation in this type and stage of the epidemic. The best thing that we can do to control the epidemic is provide testing and isolate those who test positive. This is not influenza, the flu. It does not spread as easily. It does not require these strict types of social distancing. It is important to protect the elderly. It's important to protect the vulnerable populations. Those people need to definitely be more concerned, but the general population, there's no value that we know of as infectious disease epidemiologists for this strict social distancing.
Even in the United States, as we speak, there is a significant amount of what many would call a lockdown. You think that that's not required right now, that perhaps there are other ways to contain this?
Correct. So every epidemic is local. every epidemic response should be based on the local epidemiology. So in Wuhan, China, they had a rapid increase. They implemented awareness, personal behavior change, but it was very late in the timing, so they were forced to impose social restrictions. In other countries, they've had other strategies based on testing and isolation. In major cities in the United States, the epidemic has come down without very strict interventions before you would expect those interventions to have any impact. Seattle, San Francisco have all decreased. So we must be careful and we must focus our interventions based on the local epidemiology in each town, in each city.
All right, if I could actually just take that point across back to Dr. Bhan. Dr. Bhan, like Dr. Kloss is saying, it has to be customized and designed to where you are and what your specifics are of that geography, of that society. Now, we are looking at a situation right now where the testing centers still need to be stepped up. We need to bring in a lot more kits, and that work is still on. Yep. In such a scenario, then is isolation the best available solution for us right now? Dr. Bhan?
So with the development of testing and the expansion,
I think in our context, I mean, again.
Yes, Dr. Bhan.
Sorry, yeah. So I was just going to say, yes, I think that, I mean, again, yes, certainly the response needs to be local. But I think we also need to recognize that as a country, we are the second most populous country in the world. And, we've been, many of us have been arguing that we needed a much expanded testing strategy much earlier, but we didn't get there. But I'm glad that things are picking up pace now. So I think what we are also hoping to do, I think, through these calls to social distancing is probably try to convince people that, there is, given that proximity is an issue and that, while it might not be as infectious as some other kinds of diseases, as was pointed out, there is still the challenge that there is a possibility of spread of infection. And I think we are trying to buy a bit of time till we get our expanded testing strategy in place, till we get enough testing centers established. And quite honestly, we are not there also with being prepared for the kind of isolation wards that we need, the number of ICU beds or ventilators we might need. So while we ramp all of that up, I think this might help us buy some time. Now, again, the evidence on this is probably growing. There is new evidence coming in, and we should certainly be cognizant of that. But I think that evidence will probably also need to be absorbed by policymakers and then be nimble in the way they respond. So I think it's extremely important for us to recognize that the one thing we were not doing very well on, despite a lot of people suggesting that, public health experts suggesting that, is testing. And hope the government listens and ensures that we have testing widely available so that those who need to be tested are tested at an early time, and then those who are tested positive are isolated, provided medical care, and then you try to minimize the spread or the further spread of infection. I think we are lucky so far in India. We've not seen too many cases for the size of this country, but the situation could go south in terms of getting very, very worse very, very soon. And so it's extremely important that we are on our toes to prevent that. And hopefully the Prime Minister's personal appeal and his interest in taking leadership in this domain will help us get there.
Sir, I just have one more question for you. Until the time that the vaccine gets developed, what would be the best way for the world to come together and then fight this or minimize the infection?
So the best thing is going to be careful monitoring of where the infection is.
So
very strong local epidemiology, and then based on where the cases are, targeted small level interventions. There's no reason whatsoever to be engaging in a national shutdown. This does not spread the same as influenza. It's actually not that easy to spread. It's very localized. It's also very temperature and humidity dependent. Every city that's had an outbreak has been cool with moderate humidity. We've not seen substantial transmission in the population in warm, humid, or warm, very dry climates.
Well, that's good news for a country like ours as we head towards the summer season. We are hoping that that helps us battle coronavirus in a better state. Dr. Claus, I really appreciate you joining us, all the way from Los Angeles and giving us your expert views. Very quickly, from also, what he's saying and what our Prime Minister has said, we're obviously far, far away from a situation where we need to go into a lockdown. But the coming few days and weeks perhaps will also be important to see just how we as a nation react to the Prime Minister's appeal and how much of restraint we show.
That's right. And I think India is culturally a very hangers around country. We have more people hanging around doing nothing on the streets, even under normal circumstances. And I think that's why the things like Janta Curfew, you asked that question to one of our other experts. I think for many people, it may sound like a theatrical appeal, but to me, I think he has displayed some sense of understanding of how India is. Indians only tend to react and see a situation as serious when you actually introduce a completely out-of-the-box idea. This is a very out-of-the-box suggestion that the Prime Minister has given, that you do this for 14 hours voluntarily, don't step out. And he's made it look a little demi-official by asking the police and other people to actually go out and announce that people should come out and actually pay their thanks to the emergency services that are all working. Now, it may sound theatrical, but I really believe this is a very extraordinary situation. And in an extraordinary situation, you do need extraordinary responses. So when you push something like this, and believe me, from now till Saturday night, you will see a lot of explosion of pushing of this message that will happen. It should have some desired impact on people who are still not ready to believe that stepping or not stepping out of the house if you don't need to is perhaps the best way to handle this. We do have a tendency to crowd around doing nothing really. I mean, we kind of hang around. We're just too many of us and we hang around for no reason. And that's something that really needs to be avoided at this point of time.
Yes, well, this is just for a day, for 14 hours, that he is asking everybody to show this restraint and stay indoors and kind of follow a voluntary curfew. Like Vinay is pointing out, perhaps it's just for us to get a sense of what we need to do right now to ensure that this virus doesn't spread further. We need to contain it in the current stage, otherwise it will become extremely difficult, and one of the biggest challenges perhaps we've seen in the recent times if this infection spreads more beyond this. But right now we don't need to panic. We need to take charge and we need to just do a few basic things. We need to ensure that health and the safety is of primary importance, is given the biggest priority in our lives right now, that we don't take it for granted about our own health and those around us. Let's not think that it's all right, I can get out, I am fine, I'm healthy, I don't have the infection and I'm not going to get it. That's not how this is going to work. If you've been diagnosed with a medical condition, it's even more important that you stay indoors for as much as you can. It's not an easy task to do. It can get very, very challenging and taxing when done over a long period of time. But somehow, as a country together, we will all have to do this. To begin with, let's respond to that call for Janta Curfew this Sunday. Thank you so much for joining us on this broadcast.